let's talk about now coarctation of aorta. So, what is a coarctation of aorta? Well, it's in a simplistic words, coarctation here is just the aortic narrowing near the insertion of ductus arteriosus, which is known as juxtaductal. It is associated with bicuspid aortic valve, other heart defects, Turner syndrome. So these are all the associations. Hypertension in the upper extremities, while lower extremities are cold with weak delayed pulses. That is an important thing, which is called brachiofemoral delay, meaning so you have hypertension in the upper extremities, but in the lower extremities, you just have very delayed pulses, leading to cold and weak extremities, lower limbs. With age, there is intercostal arteries enlarged due to collateral circulation. Arteries, they would erode the ribs because when they enlarge these intercostal arteries, they will erode the ribs, causing notched appearance on chest x-ray. Complications include heart failure, increased risk of cerebral hemorrhages, which barrianeurysm is the most common, aortic rupture, and possible infective endocarditis. So we will see hypertension in the upper extremities, high yield point, with hypotension or delayed pulses in the lower extremities. On top of that, you will see lower extremity claudication. Why? Because they're not getting enough blood. They're going into ischemia. So you will see lower extremity claudication. What is claudication again? The patient is going to walk a little bit and he's going to have, that patient is going to have the pain. And that pain is due to low blood flow causing ischemia to the lower limb muscles, right? So lower extremity claudication will be other things. For the eroded ribs, which will show you a notched appearance on chest x-ray, these are going to present as pulsatile intercostal arteries. Okay. On top of that, because now you have developed, let me change color, you have developed a collateral circulation. So why would you develop collateral circulation in the first place? So here is the thing, right? So we have a coarctation here, narrowing of the aorta. Aorta is not, there is a narrowing, so there is a decrease in blood flow to lower extremities. So there will be some collateral circulation being formed from this, from the intercostal arteries. Right? Collateral is going to form. From this collateral circulation, what's going to happen is you will hear a murmur because of this collateral circulation. That murmur is going to be a continuous murmur, but it's, again, what else was a continuous murmur? That was a PDA, right? But here, this continuous murmur will be auscultated. You can auscultate this continuous murmur at the back of the patient, on the back side of the patient. While if you recall the PDA had a continuous murmur, but that was not, you would hear it at the location of the PDA. I think it was in infraclavicular, as far as I can recall. But this one is just straight to the back. So again, high yield point, murmur, continuous murmur, but you can hear on the back. You're looking at coarctation of aorta. Okay, what else might be there? So now let's look at the complications. Complications, we said, okay, we have heart failure, we have barrianeurysm, and aortic rupture. So again, because you have a coarctation here, the left heart, left ventricle will undergo hypertrophy because it's trying to push that fluid here, but there is coarctation, it's narrowing, so it can't push. When it can't push, it's going to go into left ventricular hypertrophy. That left ventricular hypertrophy will give you again one more thing. S for gallop, S for heart sound, and eventually it's going to go into heart failure, uh, or it can cause battery aneurysm or aortic rupture because of so much flow coming here. It can rupture the aorta and in fact possibly infective endocarditis. So let's just recall this quickly. Coarctation of aorta. It's an aortic narrowing. Coarctation, aortic narrowing, where just near the insertion of ductus arteriosus, known as juxtaductal. Sometimes they will say it's distal to left subclavian artery. That's the location, and it is associated with your aortic bicuspid aortic valve or your heart defect, Turner syndrome, high yield. Other than that, the features are hypertension in upper extremities, hypotension in lower extremities with delayed pulses, known as brachiofemoral delay. On top of that, you will also have with intercostal arteries enlarged. They will lead to collateral circulation, which will give you notched appearance on chest X-ray. Okay. Complication is left ventricular hypertrophy causing S4, leading to heart failure, battery aneurysm, aortic rupture, and that's all for the coarctation of aorta. On top of that, one more thing, high yield, which is the murmur. Same murmur as PDA, but the location is, you will hear this murmur at the back of the patient. And that is all for coarctation of aorta.